so confused. Nurse practitioners, providers. So, are you my doctor? Well, that's a great question, and thank you for asking. So, a nurse practitioner is defined as a registered nurse who has prepared for an advanced role by gaining additional knowledge and skills through their advanced practice education in nursing. Oh, okay. Yeah, that makes sense. As nurse practitioners, we are providers, but we also have a nursing degree. So with that comes the bedside manner and that experience from the time we spend as a bedside nurse. Well, if you're not the same as a doctor, do you guys do the same kind of things throughout your day? Well, we do things that are very similar to a doctor, and we are labeled as a provider because we are providing healthcare to you. So a couple examples: we record your medical record history, update the records, document your symptoms. So you'd come into the clinic, tell us symptoms, we would document that, and then order the appropriate labs, tests, and diagnostic procedures, and then perform a detailed examination to get the data that we can, and then order the appropriate tests. Oh, okay. Yeah, that makes sense. Thanks for that explanation. We do have the ability to prescribe meds and perform small medical procedures, and we manage nurses, CNAs, LPNs, RNs in our clinic or in our place of employment. Okay, well then what's like your scope of practice? So this is kind of interesting even to me. Depending on where you are, there are different scopes of practices that nurse practitioners have. So in Iowa, for example, nurse practitioners have full independent practice authority, and this allows them to evaluate, diagnose, and order, interpret diagnostic tests, initiate and manage treatments, all independently, and their license is not contingent on contracts or relationships with a physician or oversight by the state medical board. Okay. On the other hand, in the state of Michigan, for example, a nurse practitioner must work under the direction or have indirect supervision from a physician. Then you guys are able to do different things and can't do some things depending on where I am? Yeah, that's a good question. So while both states allow collaboration with physicians, Iowa identifies nurse practitioners as having full independence, and Michigan does not. Do you guys have any governing bodies or maybe an organization or something that you guys can learn more, or I can learn more? So yes, there are professional organizations. The American Association of Nurse Practitioners is currently the largest professional nurse practitioner organization. Their mission is to empower all nurse practitioners to advance quality healthcare through practice, education, advocacy, research, and leadership. I've learned so much today, but if we were to summarize just kind of the most important thing that I can tell my friends and other stuff, what do you think I should tell them? Well, it would be that in full practice states, nurse practitioners are more likely to practice in rural and underserved areas. Thank you so much for your time, and well, you're welcome. And thank you for your time, and I look forward to working with you in the future. And thank you for watching, listening to this, and continuing to promote and push the field of nurse practitioners into healthcare.